And now we're covering facial bones. So all of our facial bones, and then we'll look at some of the actual landmarks associated with those bony landmarks within the bones. And then also we'll look at the eye socket. The eye socket's actually 7 bones, and our next video will describe those 7 bones that make up the bony orbit or the orbital complex. So when we look at our facial bones, part of it makes up the eye socket. And what we'll look at is, we already covered frontal bone. Then we move on to nasal bones. So the bridge of my nose is nasal bone. The rest of it is mostly cartilage. This is my nasal bone. In between the 2 nasal bones is where I have a suture called the internasal suture. And then coming up that runs across, this is frontonasal suture. Frontonasal suture, because it's connecting nasal bones to the frontal. And then very light, but just that little squiggly line there, this is frontal suture, also called metopic suture. So this is frontal suture running across like it's an upside down T. Frontonasal suture, and then internasal suture in between my nasal bones. So I have my nasal bones. When I come inside the eye, just this little small area here is the lacrimal bone. And it's where your tears come out when you're crying, when you gotta learn all this stuff. This is called the lacrimal bone. And lacrimal bone will help as we produce tears here, and it rolls across my eyes. It'll fill up in a duct here that we'll talk about later. But where that occurs, it's so small, the bony landmark is pretty much all of the bone, and it's called the lacrimal sulcus or the lacrimal groove. So this is my lacrimal bone, but the landmark is the lacrimal groove. So when we talk about identifying things, is it the bone versus the bony marking? It depends on how it's asked. So the landmark is the lacrimal sulcus. When I come down and we'll look at my cheek, this is zygomatic bone. Zygomatic, and zygomatic bone has a process here that's called the temporal process, and the temporal process connects to the temporal bone, but it's connecting by way of the zygomatic process of the temporal bone. That should be confusing the first time I say it. The 2 bones come together, zygomatic bone and temporal bone. Those create what we call the zygomatic arch, which is that nice curve of the cheek. What we're describing are the 2 bony landmarks that are coming together. So the process is the opposite of the bone. So if this is zygomatic bone, and I divide all of this in just half, this anterior portion is called the temporal process. The other side is the zygomatic process that's part of the temporal bone. So zygomatic bone, temporal bone. The processes are the opposite. Zygomatic process, temporal process. As I come down then, where I grow a mustache, and it'll come up along the sides of the nasal bone. This is all maxillary or maxillary bone. Maxillary or maxillary bone. And then I also have the vomer bone. The vomer. Previously we talked about the nasal septum, which is that whole middle sheath. That whole middle sheath is the nasal septum. But the top half of this sheath is the perpendicular plate of the ethmoid bone. The bottom half is the vomer. Those 2 come together to become the nasal septum. If they break or they don't fuse together straight, it's called a deviated septum. The other thing we can see inside, which is its own separate bone, is the inferior nasal concha. So on either side, this fold just on the bottom here and here is inferior nasal concha. And so we also have middle and superior that are part of the ethmoid bone. On the picture that I'll show in the video, you can see that a little bit better. But as I describe all these folds inside, they're called concha. So it's everything besides the nasal septum. As I breathe, it creates a turbulence to help clean, warm, and humidify the air in preparation for respiration. So I look inside, the bottom folds on either side, inferior nasal concha. The bone that comes down here to project is the vomer. And we were leading to then the mustache bone is the maxillary bone, which also includes the roof of the mouth on the anterior side. So this is anterior. the roof of the mouth. This is all still the maxillary bone, but the bony marking is called the palatine process. The palatine process. As I go to the posterior, then we see the palatine bone. So I highlighted that with green there, palatine bone. So this can be confusing because the anterior portion is the maxillary bone. The posterior bone is the palatine bone. But the actual name of the landmark or bony marking is the palatine process. So I have two bones that really are creating that roof of the mouth. When I look at the teeth, and we see where the teeth are coming together, but I have these projections, and not the teeth itself, but these are called alveolar processes or alveolar parts. So we'll often see alveolar parts as just referring to these little projections that help create that socket for the teeth to go into. We'll see it part of the maxillary bone, but then when we see it on the mandible. So let's get into the mandible. As I look at my jaw or my mandible, it's really just a nice L. And it just repeats on both sides. So when I describe the L, the mandibular ramus is the first part of the L, and then the body is continuing on with the letter L. So mandibular ramus, mandibular body. When I look at the projections that are up at the top here, the one that connects into the temporal bone, it's connecting into the mandibular fossa of the temporal bone. You can see a little bit of cartilage there. It's actually fibrocartilage for that shock compression, but it's going to sit inside of there. What I'm describing is the condylar process. So this is the condylar process that's going to go into the mandibular fossa. On the anterior side, it's called the coronoid process. So two processes, condylar process, coronoid process. But it's the condylar process that goes into the temporal bone at that mandibular fossa. As I come down, we see this mental protuberance. This is referring just how the jaw comes out here, mental protuberance. And then I have two holes here, which are called mental foramens. Remember, holes are foramens, and I actually use that for, remember, holes are not just holes. We put something in there that's extensions of nerves, so I can feel that. So these holes in front are mental foramen.